Hi everyone, welcome. We're just gonna wait a couple more minutes for people to join, so please hang on as the number of participants slowly rising up. Yes, please drop in the chat where are you joining from. It'll be good to know where you're joining from. We have a global uh, panel of speakers, so it's lovely to connect with you all.
Actually, it's very nice to see this very diverse participation from all around the world.
The number of participation are still increasing, so please just give us a couple more minutes so that and we'll get started. Thank you everybody for your patience.
Shall we start?
Yeah, so welcome everyone. My name is Thoại Ngo. I'm the chair of Population and Family Health at Columbia University. On behalf of SRHM and Columbia PopFam, I'm delighted to welcome you all to this global webinar. It's great to be in company with all of you on the sideline of the Commission on Status of Women. And I just want to say thank you to Esther Kismodi, Jessica McKinnon, Sapna Desai, Nicole Haberlin, and Joe Brennick for your leadership in putting together this wonderful event today. And before I begin, I want all of us to imagine an 8 months woman who are pregnant, walking through flood water, trying to reach a clinic. The roads are washed out, the health clinic is closed, and the midwife is also trying to get there in this flood zone. And the question in front of us become quite urgent. will she get the care she needs in time? That is not something hypothetical. It is something that our speaker are responding to on the front line. And it is happening right now in many parts of the world. It's point to something that I think we don't say enough in our work. That climate change is not just an environmental crisis. It's a reproductive health crisis, it's a maternal health crisis, and fundamentally it's a justice crisis. And yet, too often, our systems are not designed to respond in the way that it is existing. We still work in silo, climate mitigation over there, climate adaptation over here, and have been largely neglected for several decades. Reproductive health over here, infectious disease over there. And gender is often nowhere to be seen. But in reality, these issues are deeply intertwined. We know, for example, that exposure to extreme heat during pregnancy increases the risk of serious maternal complication by more than 25%. That heat exposure early in pregnancy raises the risk of preeclampsia. That it contributes to low birth weight, infectious disease, and birth defects. And that in some setting, occupational heat exposure can double the risk of miscarriage. So when we talk about climate change, we are also talking about rising risk in early pregnancy and childbirth. And this is not only a global south issue, it's happening right here in New York City where CSW is taking place. In New York City, more than 500 people die each year from heat, and Black New Yorkers are twice as likely to die from the heat compared to white residents. And across the United States, extreme heat is associated with increased maternal hospitalization for life-threatening complication and even greater risk on impact for Black mothers. This is not biology. It's about inequality, environmental exposure, systemic neglect due to social and economic exclusion. So when we say climate justice, we also talking about reproductive justice because the risks do not occur in isolation. Heat affects pregnancy outcome, air pollution affects fetal development, floods disrupt access to contraception and safe delivery. My own work on child marriage have seen a spike in child marriage when there's flooding happen in South Asia, in sub-Saharan Africa. And environmental degradation, often driven by extractive industry or the concentration of harmful land use in Black, Brown, and Indigenous community, undermine both the ecosystem and community health and rights. And yet, despite all of this, gender remains largely invisible in climate policy and climate action. And climate remains too often peripheral outside of our work in sexual and reproductive health and rights. That is the gap that our panel are going to solve today. Because if crises are interconnected, our solution must be as well. And climate adaptation must include the continuity of sexual and reproductive health services, and environmental policy must be grounded in the rights and accountability. And women and girls, so often at the front line, must be at the center of climate response, not at the margin. This conversation is especially timely. The priority theme for this year CSW focusing on strengthening access to justice for women and girls. But justice in this context must mean more than laws or policy. It must mean the right to safe pregnancy in a climate-affected world, the right to bodily autonomy, even in times of crisis and displacement, and the right to live in an environment that do not systematically put some community at greater risk than others. In other words, justice must be environmental, reproductive, and deeply gender. And that's exactly what this panel brings together. We have an extraordinary group of speakers working across climate justice, feminist organizing, frontline care, and research across diverse settings. And I have to brag, some of them are Columbia Pop Fam alumni. And together, they will help us move beyond the silo toward solutions that reflect really how community and how people live and what justice demand on the ground. So I want to say thank you so much for joining us today, and thank you, panelists, for your time. And I'm really looking forward to this conversation. Over to you, Esther.
Thank you so much. I really appreciate and good morning, good afternoon, good evening for everyone. I'm Esther Kishmodi, Chief Executive of Sexual and Reproductive Health Matters, and very happy about this collaboration and that all of us are here. I would like to first welcome our panelists and really looking forward to this conversation. I will moderate the discussion that will be more in a conversational format. And thank you for all of you who are joining from all over the world. So I just go through our panelists. So also you recognize the faces and where everybody, both in terms of professionally, institutionally, and geographically situating. So hello, Marta. Marta Schaaf is the Director of Climate, Economic and Social Justice and Corporate Accountability Program at Amnesty International. Thank you very much, Marta, for being here. Hi, Sai. Sai Jyotirmai Racherla is the Deputy Executive Director at the ARO, Asian Pacific Research Center for Women. Hi, Sai, you are joining us from Malaysia. Hello, Alan. Alan Maleche is the Executive Director of Kenya Legal Ethical Issues Network on HIV/AIDS, KELIN. Alan is joining us from Kenya. Thank you for being here. Neha Mankani, who is a midwife, humanitarian engagement and climate advisor at International Confederation of Midwives, joining us from Pakistan. Thank you, Neha, for being here. And Alaya Khalifa, who is a postdoctoral research scientist, Healthbourne Department of Population and Family Health, Columbia University Malman School of Public Health. And Marta and Alaya are joining us from New York, United States. So I'm inviting the panelists to start to engage about environmental justice. And as Twai pointed out, it's becoming central of political debates. The today conversation, we are bringing an intersectional lens and we are linking environmental justice with social, economic, and development justice and gender equality. As I pointed out, the CSW theme is access to justice. We are looking at access to justice not only from the perspective of access to justice in terms of access to remedies and judiciary and redress, but from a broader scope of justice, access to justice, what it means for reality and in life. We will talk about extractivism, community rights, climate justice, and also about research, that how research and evidence is shaping our action as it is connected to accountability. So, Marta, I am turning to you first. And just can you please start us up about how the topic of environmental justice is unfolding within a complex political environment? Shrinking civic space, shifting global governance, growing influence of corporate actors and resource government. So can you please connect us to the political dynamics, accountability, and communities' ability to influence decision about land, health, and development? Over to you, Marta.
Thanks, Esther. I actually had a few slides. Is it okay with you if I share them, or do you want me? That's okay.
Jessica, can you share, please?
I've got it. We agreed.
Okay.
Um, sorry, just. I'm
And maybe just the full screen down there on the right and bottom corner. No?
Sorry, I'm having trouble getting the. Do you want to try, Jessica? I'm just blocked. I can't actually get the.
So maybe stop sharing, Marta, and Jessica can pull it up.
There we go. There we go.
Okay.
Okay. Can you see it? I'm sorry about that.
Yes.
Okay, perfect. And I won't take too long. I know you wanted this to be conversational, Esther, and it's nice to see so many familiar names in the chat. Welcome, everyone, of colleagues and even a student. So thank you for having me. And I'm going to try to link concretely some of the concepts that Esther and Twy have brought up. With some examples, hoping that it lays the groundwork for some of what the subsequent panelists are going to discuss. It's quite, I think we all are here because we realize how relevant these linkages are, but these are not always links that are made in both policy and practice and the way that we talk about the issues. So I'm going to try to do that without being so general as to not be helpful. So wish me luck. And again, as Esther and Twy noted, access to justice is the theme of this year's CSW. So I'm going to use it sort of as an organizing frame for the remarks and hope that this lays the groundwork for the folks that come next. So as many of you likely know, the CSW adopted agreed conclusions last week. There was a small minority group of countries, so this gets to Esther's question about what's happening right now, led by the US, which undermined possibilities for reaching consensus, and they called for a vote on the text, which is atypical. But despite this sort of delaying tactic, obstructive tactic, the agreed conclusions were adopted. And so what I'm going to do next is look at this notion of access to justice through the lens of some of the ways that Amnesty seeks to intervene, using that as a lens rather than as a way to do it. To prevent the violations that give rise to a need for access to remedy in particular, and to promote access to justice. And as Esther said, again, access to justice being broadly defined in terms of participation and decision-making power, formal and informal mechanisms for remedy, access to civic space, to freedom of expression, association, and peaceful assembly, and to reparative justice, and so on. So I just want to note that the question of access to justice in the context of SRHR and environmental justice is shaped, of course, by the broad historical context from which we've come. And of course, the settler colonial past, and in the post-independence period, the neo-colonial governance that shaped relationships among countries has typically been grounded in patriarchal approaches to governance. And this is particularly relevant in the context of both gender and environmental stewardship. There's a misogyny-driven devaluing of what's been described as feminine, including in this stewardship of the earth and protection of communities from pollution, right? At the same time, we've seen decades of growing economic inequality and a system of global economic governance that is rigged in favor of higher income countries when it comes to trade, when it comes to intellectual property. So we saw this in the context of HIV drugs and COVID drugs, to taxation, right? To where corporations are declaring their profits, and thus where the taxation from extractive industry, for example, where those taxes are levied and which governments benefit from them. And of course, a punitive debt, which often traps low-income countries in particular into extractive industries, which is a way for them to produce the cash that they need in order to pay off onerous debt, including fossil fuels, but other extractives that also have been directly tied to reproductive health harms. In this system, too often we looked at GDP growth as a proxy for improved well-being. When this left out questions of equity, questions of distribution, question of care, and of course of human rights. And of course, I want to acknowledge that many of you here have been involved in significant investments in global health and development, and in human rights infrastructure. And there are massive success stories that we've seen over the last 30 years, such as the treatment of millions for HIV, improved access to family planning, et cetera. But I also want to recognize that as a whole, these efforts are we're unable to solve many of the macro drivers of inequality and disempowerment at scale, right? So we've chipped away at them, we've improved the situation, but these prevailing dynamics remain. And this has enabled the sense of injustice among many to grow. And in some cases, this has translated into elections and other outcomes that actually valued authoritarian governance as a way of redressing frustration and anger and bringing perceived order. So what we're seeing now, as relevant again to the topic at hand today of SRHR and environmental injustice, we're at a pivot point with many countries that have been characterized by authoritarian practices where this has been prevalent for decades. Some of these countries are growing in both hard and soft power on the international scene. And we also have authoritarian momentum in new countries that have been relatively free of that, at least in their domestic policy. The US most prominent among these, right? And this has grave implications for gender, for environmental justice. We see the weaponization and exporting in the revised global gag rule, for example, of moral panics about gender in the context of these rising authoritarian practices. This includes direct funding of anti-trans efforts, including by corporate actors, extractive industries based in the US and elsewhere globally. The continuation of paradigms that are focused on protection of women and girls rather than empowerment. And I just want to raise this notion because I think it's helpful for bringing together some of the themes of the day of petromasculinity, which is a concept coined by political scientist Kara Daggett to describe the intersection of masculinity, fossil fuel infrastructure, and political power. And so it looks at how cultural and emotional attachments to fossil fuel industry, so sort of hearkening to an idealized past, which of course has huge gender implications, has become tied to traditional masculine ideals like strength, dominance, and self-sufficiency. And it often manifests in promotion of sort of muscular male imagery, denial of climate change, and resistance to environmental regulation. As part of the same movement, we've seen a dismantling of the rights that help us to deal with the growing triple crisis of climate change, environmental degradation, and biodiversity loss, right? So we see direct attacks on freedom of expression, association, and peaceful assembly, the erosion of civic space that we all have been hearing about for years, but which has certainly accelerated across the world. And we see some of the most powerful countries that are accelerating that also imposing it on others. Decreased access to information, the deliberate spread of disinformation, particularly in the realm of science, information related to abortion, information related to climate change, to changing patterns of weather, et cetera. And then the defunding and weaponization of the public services that are essential for resilience. And by this, I mean health, emergency services, and social protection. And so by defunding, I mean, of course, decreasing our funding for these things, but the weaponization is very much linked to the moment we're in. And we're talking about welfare chauvinism and efforts to divide populations in order to create support for defunding of public services, right? Making things into a zero-sum game where someone else is benefiting from a service takes away from another group. And this also serves the additional purpose of making collective action more difficult, right? If we're all fighting each other, then we're unable to band together and to demand changes to the current system of governance. I was going to get into the amnesty engagement, but thinking about your question and seeing the number of panelists, I think I'm going to put that on hold. And if there are questions kind of come up with it, you can quickly look at the slide here just to see some of the ways that we've been trying to engage in this and to say that, you know, we've been thinking about participation at all levels and balancing that participation with a very sober-eyed view and research on the roles that corporate actors play play in global governance, right? So it's not just enough to say that affected communities need to be at the table. We also need to ensure that the polluters who are benefiting from the current situation don't wield disproportionate influence. They don't face the same challenges when it comes to freedom of expression, association, and peaceful assembly, or financial limitations on their participation. And I'm saying this at a CSW where we've seen, right, fewer and fewer people able to come due to cost, travel disruptions, visa concerns, et cetera. And that we're looking to expose the links between gender oppression, extractivism, and climate injustice at both the global and the local level. And this includes trying to secure some specific wins with regard to mining in the Philippines, for example, and to showing how these local level fights are entangled with struggles over the global level narrative.
Right.
So I'm going to stop there to save space for others. And thank you.
Thank you so much. Thank you, Marta, very much for starting us up in a very direct, very concrete way how power and various inequality dynamics are shaping the conversation about environmental justice and actions and impact. So I'm moving to you, Sai, and I'm asking you if you could take the patriarchy, economic inequality, the geopolitical instability, structural factors conversation that Marta started us with to more specific conversation about how all of this shape and bears the greatest consequences of environmental crisis, particularly in relation to health system and sexual and reproductive health and rights, and how the intersectionality perspectives that Arrow and your colleagues and partners are working on, especially in relation to climate change, is actually working out from the perspective where you do your work. Thank you very much, Sai.
Thank you, Esther, and greetings to all the audience in there. So, I mean, today's global context is basically reflects a new normal. And this new normal is sort of an overlapping crisis. We have been in continuation of different crises. We just recovered from COVID-19. But primarily what we see is in the last decade, especially climate change has been impacting, all of us. But now as we see it, it's just not climate change, also armed conflicts, wars, economic instability. Artificial intelligence is also coming in its way. And all these are actually creating this poly crisis, and this is further widening the structural inequalities. I don't think we have seen this kind of rapidly changing context in the last century, but this is what we are all, seeing now. It is rapidly changing as well. And this context of polycrisis, especially with the context of climate change, this is interacting with the existing systems of patriarchy and unequal power, and shaping who is actually bearing the greatest burden of environmental disruption. But if we go back, more than 30 years ago, when the International Conference on Population and Development was, it came to forth. At that time itself, we had said that we need to integrate human rights, especially the right to health, in all the population, climate, and environmental protection strategies. So there was foresight, but then, when it comes to actually action, we don't see that kind of an action panning out. And just giving you certain examples coming from the Asia and the Pacific region, evidence is pointing out to say that environmental sustainability is at the core of sustainable development. We have just come out of the Asia Pacific Forum on Sustainable Development, and we have reviewed certain goals and certain SDGs. And what is coming out from this regional process is that we are saying that environmental dimensions are negatively impacting the realization of SDGs, resulting in all the SDGs being off track. The review actually points out to the fact that all the SDGs are off track. Goal 13 is on a reversal, and then there is no data for Goal 5 and Goal 16. Goal 5 on gender equality, Goal 16 on peace, justice, and strong institutions. This kind of data is very important for us to assess who is left behind and how can we target sustainable development in these pockets. But then we don't have data to actually tell us, like, what is the situation around this. And then when it comes to sexual and reproductive health and rights, when it comes to gender-based violence, especially in the climate emergency context, this is mostly neglected. And neither do we see, SRHR, gender-based violence, these aspects being mentioned substantively in the nationally determined contributions and climate adaptation policies. This basically talks to the fact that we are all operating in silos. There is no intersectoral coordination. The gender, women's groups are working in their own silos. But then even within the governments, the climate and the environment ministry works in its own silo. The women's ministry, the health ministry, everybody is working in their own silos. So definitely we know that climate change is affecting sexual and reproductive health and rights of women and girls in this region across the life course. And this is not just this region, but across the globe. And as a result of these climate variations, we are also seeing that there is a causal relationship to earlier menarche. The menarche is basically the time of the first period. And menarche is like, as early as 8 years, 9 years for young girls. And this has direct correlation with climate change. And in vulnerable climate and emergency contexts, the number of very young people, especially coming from vulnerable communities, from poorer backgrounds, their access to menstrual hygiene products and, safety is compromised. When the other aspect that we can also look at in terms of how is patriarchy and all these social norms, the existing social norms are affecting sexual and reproductive health and rights in the context of climate change. In disaster relief responses, and this has been for so many years, we've been talking about that, menstrual health is often overlooked. The commodities, the, contraception supplies, these are all totally overlooked. And that has direct impact on access for women and girls to SRH services. When we also see that climate-related hazards such as flooding, cyclones, storms, and these are growing in frequency in this region, and these are disrupting health systems. And when in disrupted health systems, we see then that access to SRH services again is affected. And this also affects commodity supply chains, including access to contraception and safe abortion services. Data is also telling us that, I was looking at Mary Stopes International's data, and it actually says that 14 million women will be at risk of losing contraception in the next decade. And this is going to result in an estimated 6.2 million unintended pregnancies, 2.1 million unsafe abortions, and 5,800 maternal deaths. And this is what is the future that we are seeing. We are off track with SDGs. And then with the current social norms that are existing, and then the gender patriarchy playing out in addition to climate change, these are all the negative reproductive health outcomes that we will be seeing in the coming days. And this also adds up to shrinking civic space and lack of aid also further contributing to this. And the other aspect that, again, evidence points out to is the rise in harmful practices in the context of climate change, which includes like child marriages. And these are some of the examples that are coming out from this region. So overall, we do see that climate change is further exacerbating the negative social norms that women face, and environmental degradation and climate-related shocks are exacerbating social and economic inequalities. And these are disproportionately affecting women's, girls, and marginalized communities. And this is actually having additional strain on health systems, creating barriers for accessing essential services. I think one of the key takeaway that we have coming out of all this context is that one is we really need to prioritize gender-sensitive, gender-responsive climate policies, including sexual and reproductive health and rights in the climate adaptation plans. And in the first place, at the country level, the climate policies, the environmental policies need to take a gender perspective and start looking at health systems, the education systems, and then its impact on women and girls. I will stop here and we can move forward. Thank you, Esther.
Thank you so much, Sai. And we are moving to Alan and moving towards the direction that both of you, Marta and Sai, raised around governance, politics, development, justice, and human rights. And most recently, I had a great pleasure, Alan, of recording a podcast conversation with your colleagues about gold mining in Kenya, and your work with community representatives and broader human rights and community actors, really highlighting all the dimensions that we talked about in a big picture. And it would be really great to hear from you through a very specific example what is happening right now about why political participation and community involvement is important. What does it mean in relation, what extractivism means, for example, in relation to land ownership, dignity, and how it actually connects to sexual and reproductive health and rights. Over to you, Alan. Thank you so much for being here.
Thank you, Esther. I want to first of all start with the good news. For those who followed the conversation today, we just got news that the court gave an order stopping all forms of mining in the area and for the company to start the public participation process afresh. So that definitely means that at least someone is hearing and the judicial system is working. For those who are wondering why Esther and I are very happy, this is coming from a conversation that we had a few months ago relating to the issue of mining being a great issue of extravism. So we had an issue in an area called Kakamega in Kenya. And one of the clearest ways extravism intersects with sexual and reproductive health and rights is through, right now in Kenya, there's rapid expansion of artisanal gold mining in rural communities and also companies that want to do it in a large scale. So in counties like Kakamega, where I come from, and also in Migori, a neighboring county, mining activities have continued to intensify faster than how they can be regulated, the environmental safeguards, or even health system preparedness. So a key concern that communities and people who stay there have raised is that decisions about land use, licensing, and mining operations are often made without meaningful public participation or access to information. And this is partly what our podcast was able to highlight, that despite community members writing letters, pushing back, the lack of on the ground, the lack of participation is definitely shaping community realities in a negative way. We are seeing an influx of predominantly male migrant workers, the emergence of informal settlements around mining sites, and also increased economic pressure on households whose farmland or traditional livelihoods are disrupted because people are digging, water is polluted with the chemicals that are used to clean the gold, which contain also mercury. But we've also seen and documented women and adolescent girls being particularly affected. So in the community dialogues we've had, and media interviews that have covered this aspect, there's rising exposure to transactional sex linked to income instability, increased risk of gender-based violence, young girls or young persons leaving school earlier than expected, and growing demand for sexual and reproductive health services such as post-abortion care, STI treatment, and maternal health support because, of course, you can imagine what is going on in the situation. And often, some of these things are happening without any additional investments in the near healthcare facilities, which are already overwhelmed. So you can see that connection. You're bringing in an activity that is causing harm to the environment, but with it, there are other health aspects, there are other social health aspects that are affecting people individually, particularly the most vulnerable women, girls, young people. And then they're putting a burden on the health system. And then on the other hand, you have the environmental degradation linked to mining. I've talked about the unsafe water disposal, water contamination, which then has a trickle effect on the food security, where a lot of people rely on arable farming, nutrition, and also just generally the overall household well-being. So we have seen clearly when communities are excluded from environmental decision-making processes, these risks are often identified too late and the harm has already occurred. So through our recent podcast and blog that I highly recommend, you take a time to listen and read, documenting those community experiences around gold mining communities consistently emphasize that when you're extracting stuff, it's not only about environmental impact, it's also about the power, the voice, and accountability, because people are asking how these development decisions that fundamentally reshape their health, their livelihoods, and social structures can take place without meaningful involvement. And governments are very blind to this because they are looking at the economical gain, they are looking at the strides that will make, and even in certain situations, some are looking at the corrupt deals they'll be able to make out of this process. So this points to a broader developmental justice question in terms of who benefits from resource extraction and who bears the social and health costs. And we all know it's the community and the people, the inhabitants, who will bear the largest negative effects of the social and health costs. So let me conclude by saying that strengthening environmental governance requires not only better regulation, but having very clear enforceable frameworks for public participation. And that's why I welcome the High Court decision from Kakamega, putting a pause to the process and asking the mining company to start the process afresh in terms of gaining community consent. Access to justice remains a key pillar because where do you run to as a community member whose voice is not being listened to by the government? We only have the alternative of going before courts and other judicial bodies to be able to address this. And then we need to find a way of integrating health and gender considerations into mining and development policies. And only then can resource extraction align with sustainable development and the protection of sexual and reproductive health and rights. So, Esther, I hope that brings into perspective what we are continuing to experience and what we continue to see. And I'm hoping that this, if is happening in other parts of the world, in other parts of Africa, that colleagues will be able to see how they join forces between different groups, HIV groups, TB groups, land groups, folks working on forestry, folks working with the media, to be able to have joint interventions to push back against governments that are not listening to their citizens, or private companies that are being oppressive to the rights of communities, as we have tried to do so in the case of Kakamega. Back to you, Esther.
Thank you so much, Alan. And I think you are not disappointing anyone because this is human rights in action. I remember when we were talking and what kind of impact human rights work can have in actual reality. I remember, Alan, when you were facing this situation with your family and community in September, and here we are in March, when actually there is a court decision that is trying to bring justice into the whole process that is based on power and corruption. and how justice actually can facilitate a very different process when the access to justice is linked to development justice, gender justice, and health justice as well. Congratulations, Alan, for this achievement, because it's huge for the political participation and community voices perspective. I'm turning to you, Neha. All of the speakers, Martha, Sai, Alan, talked about the access, and Toai from the beginning in the framing of the webinar about the access to services, sexual and reproductive health services, maternal health services perspective, and how environmental justice and climate change is linked so to access issues. You are working with your colleagues in a very particular way of providing services. Can you please help us to understand that how actually from the midwifery provision of sexual and reproductive health service point of view, how this topic is connected to actual service provision and accessibility and availability of services? Over to you, Neha.
Thank you, Esther. So this is very relevant to the work that I do in Pakistan. So I'll talk about that and also a little bit about what we're seeing at ICM. So we are seeing that climate fragility is affecting maternal and newborn outcomes and also the ability of health systems to deliver care. But I want to start by setting the stage for the kind of work that midwives do and some of the really complicated and fragile climate contexts that we work in. And I want to share a little bit about the community I provide care. And I don't have photos right now, but I think it's very interesting. I do share a lot about this, the context of this on my page, and I can share that here. So this is a very heavily climate affected community, and it's a set of islands off of Karachi, which is where I live in Pakistan. So there are four islands, and then there's also the entire Karachi coast, and this is a population of around 60,000 people. They don't have access to any maternal health care. The midwife. We are the only source of maternal and newborn health support that this community has access to. So we have a small clinic at Baba Island, which is where I work. And what we're seeing is that this is an urban space, and it's one of the most densely populated spaces in the world. It's an urban heat island because it has no greenery, so it's hotter than the rest of Karachi. So excessive heat, there's no last mile healthcare access. There is complete environmental breakdown because it's a city of, I mean, combined, these places have around population of 60,000, but there's no solid waste management system. So the water is basically where all of the solid waste goes. And then when the sea level rises, which is happening a lot as we see, all of that comes back into people's homes. Beyond that, there's also very high particulate matter exposure, both from the environment, from obviously living in solid waste management, but also a lot of diesel fumes from fishing boats. But this community is like 99% is fisher folk community, and they rely on fish as their main source of resources. But because of overfishing and toxic seawater, it's leading to a very big reduction in their resources. So that combined, so that leads to poor nutrition. We are seeing a lot of neurological and other challenges in newborns who are born through our program. And but then we also see a lot of indirect things like in the summer when there is no fishing. So if there's no fishing between May and August. So men who are usually not at the islands, they're there. So we always see a really sharp increase in domestic violence. So there are a lot of the indirect effects that we're seeing related to climate change as well. Apart from things we already know that, as we mentioned, that pregnant women are physiologically much more vulnerable to heat. We are seeing high risk of preterm birth, stillbirth, low birth weight in pregnant women in heat affected spaces. Lot more I see in my clinic. Lot more increase in pregnancy induced hypertension, gestational diabetes, and uh, beyond that, we see that climate crisis also is compounding existing inequities. So women in fragile settings, as I said, these women who are in this particular space are facing malnutrition, displacement, gender-based violence, and a really fragile healthcare system, which is already completely broken down. And this, I think, is the most important part, that there is a very large element of intersectionality whenever you talk about climate. So not all women or not all communities, not all families are created equal. So people also have different access to cooling mechanisms. This community doesn't have access to electricity or to anything to cook with. So they have to cut down mangroves, which we know that we need for to breathe and for the ecosystem, the coastal ecosystem, but they have to cut it down because they have no access to anything to cook with otherwise. So there is this idea that the people who are the most affected by lack of resources are also often blamed for the destruction of environment leading to climate disaster. But what are the resources that they needed to have in space, and what are the systems they need to have in space to not reach that condition? I also think, things like lots of spaces in Pakistan, women dress differently than they may in other spaces. So that also makes them more vulnerable to heat. They have more mobility issues, so much more inside their homes and not have access to cooling. So there is that. And I think linked to all of this is also when we come up with solutions, it's so important to look at the context we're in. So, when I first started working in this space and for cooling mechanisms, I always tell women that you're pregnant, you need to have these foot soaks, and you need to put cold water on your head when you're overheating. You have to do it. And for babies, and they said we only have one can of water a day. We're not going to use it on these things. Like, it just doesn't make sense. And similarly, I had lots of really sick babies come to me, and I ask them, why aren't you boiling your water? And so we don't have access to anything to boil with. So everything is not going to be the same. Solutions will not always be the same. But this is what I see. But at ICM, we speak with midwives all over the world. We have midwives in 116, we have associations in 116 countries, and we see that much similar across communities that are living in the Sundarbans in Bangladesh, India. They have similar contexts. We see so much of this from midwives across East and South Asia, the African countries. We're seeing the Sahel region, lots of East Africa. There's currently flooding going on in East Africa as well, lots of countries in Latin America. So this is no longer something that's just restricted to certain people or certain populations who are affected by climate or disaster. Everyone is now, I think. So that's just climate affected communities. But beyond that, the climate shock. So I think a lot of our colleagues spoke about that today. But climate shocks and fragile systems also really significantly are disrupting access to antenatal care, to safe birth, to contraception, to newborn services. And there's also this element of the mental health load of being in a climate disaster, of being displaced, of being pregnant and feeling uncertain about what's going to happen. And also, what is all of that cortisol that's going through your body when you're in these kind of situations? What is that doing to your baby? What is that doing to your pregnancy and to your reproductive health system? I did a lot of work in a flood in Pakistan in 2023, and I was in an IDP camp, an internally displaced people's camp in a flood. And I really think that of all of the spaces I've ever worked in, when people are displaced, I think that is the saddest that they ever are, because they lose their community, their safety systems, and it also very significantly affects how they uptake their care. So midwives, where they come in, and this is what I see in my work, I see it in midwives all over, that midwives are frontline health workers, and they often become, because of they belong to the community spaces that they work in, they often become the last functioning point of care when health systems are disrupted. So they are a big part of the solution that we see. And what a lot of the advocacy that I do at ICM is that we really need to integrate frontline health workers, midwives, who are seeing what is happening on ground and are a low cost, very sustainable healthcare solution. Really need to integrate them into health systems and scale them, because community-based care models really do remain functional during disruptions, but they're also very low tech. And I think low tech solutions is what we really also need to be looking at right now. They also ensure continuity of SRHR services during crisis. We've always seen that. And when primary healthcare systems are strengthened and our midwifery care can be integrated into that, that also leads to another element of continuity of care. So this is what we are seeing in the midwifery landscape, and what we're trying to do now is trying to integrate humanitarian competencies into midwifery health workforce education, so that all midwives know what it's like, what they need to do to be able to work in climate effective humanitarian settings, and also invest in local associations and frontline providers, because we really do see them as the solution going forward. So that's a little bit from me. Thank you.
Thank you very much, Neha. It's really fantastic to listen to you. And I try to share the couple of links from you that also contains some photos illustrating your work. But would you be so kind to share it with the audience, those that you refer to? And really congratulations for the amazing work that you are doing. And thank you very much for sharing your experience. And I think from here we are directly leading to Alea as well, that how this documentation, hearing Neha, you are actually doing the work, helping women and children and people on the ground, but you are also sharing your experiences to learn from the experiences. And Alea, we are moving to you that why the documentation of experiences, why research, why evidence is very important, why does it matter, but not only, how do we need to challenge the type of research what we are doing. And Marta, I could see that you were corresponding with someone in the chat as well, showing that what kind of research and evidence you are collecting with Amnesty. So Alea, can you talk to us about why evidence matters, what kind of evidence we need, and how to do research. In this regard, what we heard from the panelists. And before going to you, I would like to ask the listeners, the audience, put your questions into the chat. There are already some questions. We will look at that after Alaya, and we will go to a second round when each of the panelists will have a chance to reflect on the questions that being raised and move us forward. So, Alaya, back to evidence research. Why does it matter? What kind of evidence we need?
Yes, thank you, Esther, and thank you to all the panelists for sharing all of your incredible work. I think, all of you kind of touched on evidence in one way or another. And so I just really want to start on a positive note, which is that, research on the intersection of environmental justice and SRHR has clearly come a long way. I think historically, environmental health sciences focused a lot on the biological determinants of health, which really drive biomedical solutions and don't really uncover these drivers of inequities. And so now, with better social science integration, we can really identify different mechanisms and points of intervention. And then not just that, like what I just heard from Neha is implementation science in practice and like alongside all of these sort of climate adaptation strategies. But of course, I want to highlight, some gaps in the knowledge and challenges in sort of decolonizing the knowledge we do have, which really, I think, prevents us from reaching environmental justice. For example, in climate and health research, as a quantitative scientist, we rely a lot on these global climate models. And they're incredibly well documented, right? And they're open source, and they're easy to access. But some of them, for example, are based on weather stations, and the weather stations are not evenly placed around the world. Sierra Leone, for example, has 8 weather stations, while the Netherlands has like 40 to 50 weather stations. So they're concentrated in high-income countries. It then affects the data sets that we work with and the uncertainty around data and the inability to really speak to any sort of like fine scale spatial resolution if we want to look at community disparities. So, if we're thinking about Hanoi or Ho Chi Minh City, those cities sit in like 1.5 grids of these climate gridded data sets. So how would you then look at urban heat island effects, right? And that's something that Neha brought up. So we obviously need to be investing in smarter, sustainable, locally owned data systems that can push the evidence forward that we need. And I think a lot of this is caused by top-down systems, right? So we talked about national adaptation plans, which, are wonderful. It's great that everyone is trying to write these at the moment, but that information is sort of expected to filter down to communities with sometimes, because of models like those, like massive assumptions about who is affected and how. And so then communities are expected to take on a prescribed response that might not have been based on locally relevant data, right? So implementation science tells us that actually programs are so much more effective and equitable and sustainable when you let the communities themselves drive the intervention and participate and engage in the data collection and the research. So in our Department of Population Health, we try to sort of flip that flow of evidence, so from top down to building evidence from the bottom up. And that way we create more, contextually relevant exposure measures of, extreme heat, precipitation, other environmental factors. And then we can localize evidence on health outcomes and empower communities to lead the response, right? So really giving them the access to data along the way, and then they can sort of shape their climate futures. And it's not just about helping communities. It's also about helping policymakers at all levels, because then they can develop more effective and appropriate programs for different contexts. So one of our global initiatives that I wanted to bring up is called How We Adapt, and it's trying to do this. So we're employing sort of an in-depth case study approach in 4 communities to start across Vietnam, Uganda, Sierra Leone, and Mexico, to not just document the climate impacts, right, but to document how people are already adapting to the environmental stressors in their communities, and also to facilitate cross-learning across different climate contexts, geographies, social contexts, health challenges. And so with mixed methods like in-depth interviews, photo voice, community walks, we can ask not only how they're impacted, but how they're responding, right? So just as an example, in Hanoi, we're looking at how women delivery drivers on these delivery driver apps are disproportionately affected by extreme heat, how heat stroke affects their reproductive health, and what sort of occupational protections are needed, especially when we're thinking about this sort of skyrocketing gig economy in cities around the world. And really through this work in all of these communities, we're working with our local partners to along the way in parallel redefine what an equitable research partnership looks like. So in Sierra Leone, we work alongside Purposeful, a youth-led NGO, and we partner with the Ministry of Higher Education so that we can involve local investigators from, conceptualizing the research question all the way through to dissemination. And we also partner with the Directorate of Science, Technology, and Innovation, which is quite exciting because we are not then just dropping into, implement one-off surveys or something like that, but it's really about building a research ecosystem that is like sustainable and there for the long term. And also one that is agile and can generate evidence in real time for very dynamic issues where challenges are coming up in unpredictable ways. So there, we leverage tech hubs that are embedded in schools and universities to support data collection, but then it can involve young people into the entire process, into the entire research process, and improve data access and use along the way. So really we need to be documenting local solutions, what works and what doesn't, and for whom. But the real beauty, we think, of this approach is that you are not just, doing research for justice, which is important, but achieving justice like within research itself, which is not just an ethical standpoint. As scientists, we believe that that's actually creates better evidence, right? It makes evidence reliable and relevant and representative so that we can really help support climate action and environmental justice.
Thank you very much, Alea. Thank you. And I think you are beautifully taking us to the reflections on the very rich chat conversation that is happening with the participants who are joining this webinar. My overall question, second round of question, and everybody would have about 2, 3 minutes to respond. That please pick and choose also to respond to the questions in the chat. But our overall reflection in the second round would be about what is coming and what should come in terms of looking ahead and from the collective accountability action perspective across governments and corporations and international agencies, and just looking through the questions and the conversation that comes from the participants. You are resonating on the points that were raised by Sai about how state actors and within state actors, government actors are working in silos, and also there is another reflection that it's not only the government actors, but even how the climate change actors. I think it's coming from Lungila Gininza, pointing out that how those leading NCD or climate change in the countries tend to disconnect climate change, for example, from migration and sexual and reproductive health and rights. Alan, you were addressed in relation that how community participation is kind of almost became a slogan, but it's how it's actually connected to real action. From my perspective, you exactly demonstrating that why it's important, but maybe if you could elaborate on that. And also Dr. Sriparna Chattopadhyay is raising that how politicians, when they are in a power situation to change action, whether in the parliament or in political negotiations across nations, they are kind of doing very little about all of that, what we have been raising in this panel. So please feel free to browse through the chat. So I'm going back to the panel, and the panelists, please pick those aspects that are resonating with you most. Marta, you had a very interesting conversation about your example of taxation, how it links back to the economic justice perspectives, to the environmental, climate justice, and sexual and reproductive health and rights and global health more. So I'm turning to you first, Marta, about 2, 3 minutes reflections.
Thanks, Esther. Thank you. I really enjoyed hearing from all the panelists. It made me feel right at home to be back in a public health space. So thanks. I appreciated that. I think just so to respond to the question there's a question about evidence to policy and political will. And I think, you know, we all know political will, lack of political will is a conclusion we see in so many papers and reports for years. And yet we have seen enormous changes in political will. We all work in SRHR. Perhaps, we're facing huge regression now, but we have seen huge changes. So we know there are ways to generate political will. And for me, or for us, I think part of what we look at is people power as part of that, and doubling down on more old school ways of organizing people and raising issues, not only in technocratic settings and in policy settings, but also in political settings. And what I mean by that is not just electoral politics, but looking at human rights education, looking at some of what you've been describing, Neha, right? Working with communities to set the agenda and to then build power over issues that communities identify over time. And of course, this is a huge undertaking. And I think another way that we're looking at this is while there have been unprecedented attacks on the multilateral system, just as we don't, when people march in the streets and we say, whose streets, our streets, we're trying to do the same thing with the multilateral system, right? We're not going to give up on it. And that includes litigation. It includes the International Court of Justice and their historic advisory opinion, as well as the Inter-American Court and a forthcoming one from the African Court on state obligations with regard to climate change. And trying to link that very explicitly to some of the building people power at the very local level. And the science that you were describing, Aaliyah, has been instrumental in that accountability within the court system. So I think I would say multiple levels, don't forget old-fashioned people power, and not giving up in the multilateral system. Thanks.
Thank you, Marta. Over to you, Sai.
Yeah, great discussions actually, and just drawing from some of those points that were made throughout the panel. I think we have to move towards climate smart SRHR integrated health systems. And there is some guidance on this coming from WHO operational framework. I think there is this operational framework from WHO that talks about climate resilient and low carbon health systems. So, maybe we, governments and all of us have to start looking at these guidances in order to, craft the new normal health systems, which are, climate resilient. That's one. The second is like financing. I think we need money to be resourced by the government's domestic resource mobilization, but also the international aid as well has to be mobilized towards strengthening health systems, especially in the global majority countries. The point that Alaya made in terms of research and technology, and in an ever-changing world, especially with AI coming in, I think we have to harness it ethically for the betterment of climate smart health systems. That's the third. And finally, I would say that again, we are in an interconnected world. Climate change doesn't happen in a province, in a state. It happens across the globe. And the impact of it is, it's not geographic, confined to a state. And that's where multilateralism needs to thrive, and international law needs to thrive too. So I would stop at that.
Thank you very much, Sai. If you want to come back on any of the points that, for example, Henry Salas is raising, that how organizations who are leading work on justice and climate change and environmental justice, how they are working with people with disabilities, LGBTI organizations, and other activists and networks whose needs are often neglected. Maybe Alan, you can address it as well. There were many questions raised to you, Alan, specifically in relation to how political participation, how community participation matters, but also specifically that what the government is actually doing. What can you expect from a government like Kenya in this situation? So please, Alan, reflect how it shapes in your mind in response to the questions and to the overall question. Over to you, Alan.
Thanks, Esther. I've tried to respond to some of the questions in the chat, but I think I'll begin with a bigger picture by saying, I think for me, the big issue going forward is coordination, because even from a governmental perspective, governments still deal with environment, health, gender, and development in separate silos or different ministries. And so there has to be a push to try and get governments to see things from a holistic perspective. I know it's not something new we are saying. We've said it in the HIV response. We've said it in the SRHR response. We've said it in the women's rights response, that they need to take a rights-based approach or look at things holistically is something that most governments are not doing that. And also, on the one hand, corporations, especially those that want to do large-scale mining, are regulated in one space, while communities are engaging in a different space. And so sometimes even civil society is sometimes pushing important agendas, but not always together. And I think for one thing we did deliberately in the Kakamega case is that we tried to figure out who's working on land issues, who's working on TB issues because it involves mining, who's working on water issues, who's working on media issues, and how do we raise these issues to them, who's working on issues of access to justice or governance, and how do we raise these issues to them and get them to persuade them to see that this is an area that they need to be involved in. So for me, I think what needs to change is more joined up accountability, stronger participation rights for communities, because you have to do this on your own initiative. I know there are funding challenges, but I think where you have the ability to be deliberate, to look for the groups, whether they're LGBTIQ groups, whether they are persons with disability, and being very deliberate to involve them in the conversations and seeing how these things affect them, or letting them know how they affect them and why they need to come on board, may be one way to go. I think we also need to have very clear obligations for companies and coalitions that cut across sectors. Otherwise, I feel we will keep diagnosing a problem without shifting implementation. And then very quickly to respond to a question about the issue of water in Kenya. Yes, I'm aware about it. Kelin doesn't work on it, but it comes out clearly in many drought affected areas. And the way it plays out for women and girls is that they're the ones who have to walk farthest to find water. Of course, that affects their safety, that affects their time for school or work, and sometimes their access to healthcare services, especially if they need to take life-saving medicines like ARV. We also see displacement or movement of households during prolonged drought, and even right now with floods that we are facing, we are seeing how this is causing deaths and disrupting continuity of maternal care or access to even healthcare services. So both the national and county government are trying to have investments in infrastructure, but most of it is normally donor driven. But there are more gaps, especially within the marginalized community. So participation in water governance and local planning still also remains important. So let me stop there so that I don't take too much time, but I'll be happy to answer the questions on email or offline or in any other way we connect with the panelists and the people listening to the webinar. Back to you, Esther.
Thank you very much, Alan. So turning to you, Neha, how do you think that this whole accountability question, the politics, but also in terms, there are questions about how actually a lot of questions, evidence can also influence actual service delivery and action when it comes to people, when it comes to women and girls. There was a question about how actually climate change affects or influences abortion. So Neha, back to you, that how do you navigate from your perspective through these questions and the question of accountability?
Thank you, Esther. So I think a lot of what I'm thinking has been mentioned. So I would agree with all of my colleagues on what they're saying, but a big part of it is just this breaking down of these silos, right? So this is a big part of our existence now, and it has to become, like, if you specifically speak about maternal health, it has to become a part of the maternal health strategy, not climate separately. Like the climate space is, right now, is just very separate from everything, and I think that integration needs to come in. And even, in that way, also in like data systems, like if you think about something as simple as like health data systems or EMR in places which are climate affected, and how the data that I'm seeing on ground suppose we take the example of my clinic, should not just be about my maternal health outcomes, but if I have data on what is happening with climate at that space and time, then there's some real interesting linkages that I can actually find, right? So what are the trends that I'm seeing in different temperatures at different spaces? So making those links, because there's just so much of a story to be told there. And the other thing is linked to what Julia was asking as well, which is that as a midwife, I think there's a very big role of knowledge equity, because we assume that everyone knows these things that we know, but not everyone knows all of the new evidence, especially because it's so new. So every few months, every few weeks, we'd say something new come out about what the connections are between climate change and our area of interest. But bringing that information down to healthcare providers, to the community, to people who are affected by it, and that fitting that knowledge equity gap is very important. And I think the issue is that maybe if the knowledge is getting to the right spaces, then people will act on it differently, right? So maybe midwives, like if I tell midwives, maybe they will act on it differently. Maybe women, if they know, will act on it differently. If we assume that everyone will take accountability, but at least someone who can be held accountable will know if that knowledge equity exists. And the last thing is about just capturing the lived experiences, as I mentioned, of people, there's a lot of interesting indigenous knowledge that exists in this space as well. Communities know what's happening, they know what they have been seeing these trends, and there's a lot to be learned from that. Thank you.
Thank you very much, Neha. And Alea, if you could reflect on the many questions that are in the chat about how research and researchers and how actually evidence strategically and effectively influence policies and actions from the research evidence point of view.
Yes, thank you. I see a few different questions on this, and it speaks to how challenging it is, right? Or how maybe as researchers we're not trained in communication, and how we need to work harder to disseminate the research findings in a way that's accessible. And but it also goes back to the way we do research itself, I think. So maybe three different strategies I can think of to make our research actually affect policy is one to do engaged research, like I was talking about. So involving participants and stakeholders, even the unlikely ones and ones from other sectors from the beginning of the research question. So the delivery app and motorbike drivers example I was talking about in Hanoi, we actually talked to the delivery app company, right? And asked them, how many women drivers do you have? And, and if they're participating in that research process from the beginning, then whatever dissemination you have at the end, you have a more likely uptake to actually, make a change in the health outcomes or health service access for that population. I think country ownership of data is so, so important. And that's really what will lead national policymakers to make a change, because if the data are owned and then they're trusted. So it's really about kind of fostering a culture of data use and data investment from the local level up. And so I think any research needs to, in parallel, be building the existing data system. And then finally, I think something that researchers are starting to do more is bringing the public along in the research process. I think Marta spoke to people power and how we can't forget that. And so it's not just disseminating findings to policymakers, it's also disseminating findings in a way that's accessible and usable to the public and the people who want to then take those data and feel empowered and to organize and participate in the political process. So, there are cool new methods happening. There's a street talk method that's more social media based, so short form videos, right? And doing qualitative interviews that way. And that way you're shortening the period from research to dissemination and really bringing along the public so that they feel more empowered.
Thank you very much, Alea, and thank you so much to all of you, Marta, Sai, Ala, Neha, Alea, for this very exciting conversation. We really appreciate and being so specific about your work and experiences, and also for the participants in the chat. So and engaging with the conversation. The webinar will be available, those who joined later, on the SRHM website, and also Toai, maybe you can also give some specificities of sharing. Please look at to the SRHM journal as well about our published articles. And we will have a blog, the webinar on a blog space, SRHM blog space, and all the participants will share their resources as well that they refer to in the conversation. So thank you for everyone. Back to you, Toai, for reflection and closing this very exciting conversation. Thank you very much. Toai, over to you.
Thank you so much, Esther. And I just want to say how powerful it is to hear from all of you. We really imagine this conversation to be discussing at multi-level, but also grounded in community and solution-oriented. And I hope our participants have seen how our speakers are responding to that woman I described walking through the floodwater during pregnancy. And as we navigate this area of overlapping crisis that our speaker are talking about, you can see that there are ways that we can design systems that anticipate risk and act early enough to protect people before they are forced to walk through heat or to walk through floods, waters, or impacted by heat in the first place, because that's what justice look like. So I have a couple summary remarks that I'm drawing from all of you, from for our speaker, is that we must, if we are serious about equity and justice in connection to climate action and SRHR, there's a few things that we need to drive forward together. One is that we must invest in climate resilient health system to protect sexual and reproductive health and rights. And that Neha talked about, that is about investing in frontline workers and midwives. They are integral to communities. If a midwife is missing, that woman trying to get to the clinic won't get care. So how the way that we need to really think about is to drive investment in basic community-driven health system. So I think that's one. And then the other thing that I heard from our speaker is around integrating SRHR into national and local climate adaptation plan and climate financing. So that what does that look like? That means that we need to make sure that early child marriage, maternal health indicators, sexual and reproductive rights indicator are part of the national health plan and the national financing plan, because the government won't respond if they are not measuring these indicators. And they are, should be core priorities, not just an afterthought. And I think there's something that I really want to bring out is that at governments, are negotiating with the US government around American climate global health first strategy bilaterally. It is, we have to work so hard together as organizing to make sure that extractive industry and local government are making sure that rights are at the center of this negotiation, because it's all about the US government extracting resources from this local community. And I know feminist organizer in Kenya are challenging the Kenyan government in these negotiations. And I really want all of us to work together to keep our eye, because that is direct resources going into country and attracting resource. And as you heard from our speaker, women and girls will bear the brunt. Community who are living in this mining, in this gold mining community will bear the brunt. And the ways to, and I love how Alan had talked about this, and the way that we must hold government and corporation accountable is really about working together, right? We are facing a resource constrained environment, so we must band together and really work across both the social development and health sector. It cannot just be HIV people working on alone and reproductive health people working over here, or maternal health people working over there. And then I think there's this really interesting conversation about putting women and girls and impacted community. This is something that I have been speaking to climate funders for more than a decade now to really push forward the climate adaptation agenda. Community have had solution for hundreds of years. They have seen how weather event is impacting their community, wash away their houses, eroding clinics right in front of their eyes, and they have been rebuilding and they have adapting for all these years. And I think Alea brought up this really incredible point around that, grounded in data and evidence in those community, bringing up solution. And I think we need to move beyond just kind of say, what is the impact, but what is the solution? And the solution are coming from those community. So I just want to say thank you so much for joining us in this incredible conversation. And thank you to the leadership of SRHM for this collaboration. But most of all, thank you, Alan, Alea, Neha, Marta, Sai, for all your incredible work and for pushing forward these important agenda at different levels. So have a wonderful CSW and have a wonderful week. Thank you everyone for joining.
Thank
Thank
you.
you.
Thank you, everyone.
Bye-bye.